Hi. Welcome to Homeopathy Medicines. Today in this classic Homeopathic Materia Medica lecture discuss about homeopathic medicine Euphrasia efficacilis by Dr. Farrington, MD. Before starting this video, please subscribe to this channel. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Euphrasia efficacilis, its uses and symptoms. Euphrasia is particularly of use to us as a medicine acting on mucous membranes, especially the conjunctiva and the nasal mucous membrane. It has long been known as a remedy in affections of the eyes. First, it produces an inflammation of the eyelids, a blepharitis. The eyelids become reddened and injected, particularly on their inner surface. They become puffed, dark red or red at least, ulceration takes place, giving us a discharge which is thick and excoriating. The tears themselves are profuse and excoriate the cheeks. There is marked photophobia, the patient cannot bear sunlight, but even more objectionable to him is artificial light. It has been urged by some physicians that it is splitting hairs in attempting to differentiate between aggravation from sunlight and that from artificial light. I cannot see where this objection has any force, for sunlight and artificial light are very different in their compositions. Belladonna has aggravation from artificial light, and aconite from sunlight. In conjunctivitis, Euphrasia is sometimes indicated in scrofulous cases by these symptoms: little blisters or flick nearly form on or near the cornea, the discharges from the eyes are acrid and purulent and a film of mucus seems to collect over the cornea, causing a difficulty in vision. This blurred sight is relieved by wiping the eye or by winking. We find Euphrasia also indicated in conjunctivitis of traumatic origin, and when the above symptoms are present. Arnica, which is more of a remedy for bruises, has no application to this acrid discharge or to the formation of these little blisters, so when these form after an injury, Euphrasia is the preferable drug. Although Euphrasia affects the superficial structures of the eye principally, we find it indicated in rheumatic iritis. If you examine the eye, you find that the iris reacts very tardily to light, and the aqueous humor is cloudy from the admixture of the products of inflammation. The pains are burning, stinging, shooting in character, are worse at night, and are attended with this acrid lacrimation. Now the coryza of Euphrasia. This drug is indicated in coryza which is perfectly bland with lacrimation which is excoriating. Now let us look at the position which Euphrasia holds with its concordant remedies. First of all, beginning with the eye symptoms, we find it a close ally of Mercurius solubilis. Both remedies have this well-marked blepharitis and conjunctivitis coming from cold. The symptoms of Mercurius, which differentiate it from the other remedy, are these: the discharge under Mercurius is thinner than under Euphrasia, then, 2, Mercurius has marked aggravation from the heat of the fire. Next we find Euphrasia similar to arsenicum. Both have the acrid discharge, and the formation of flicknules on the cornea, and both are indicated in scrofulous cases. But arsenicum has more marked burning like fire, especially after midnight. This symptom is not always relieved by the application of hot water, but frequently so. Nor have we in Euphrasia the marked restlessness we have in arsenicum. Another similar drug is rustoxicodendron, which has profuse gushing tears, excoriating the cheek, profuse purulent discharge from the eyes. But the pus is thinner under rus than it is under Euphrasia. Rustox attacks more the right eye, Euphrasia either eye. Rus has pains in the rheumatic iritis, darting from the eye through to the occiput, with a great deal of restlessness and agony and tossing about at night. Now the coryza, we are accustomed to associate Euphrasia with Ileum-Kippa. We make this differentiation between the remedies. Ileum-Kippa has excoriating coryza and bland lacrimation, Euphrasia, bland coryza and acrid lacrimation. There is still one other application we may make of Euphrasia, and that is in paralysis of the third pair of nerves, causing ptosis, especially when caused by catching cold, in rheumatic patients. The allies here are rus and causticum, both of which have exactly the same symptom. This gives you very nearly the precise position of Euphrasia in the treatment of catarrh of the eyes and of the nose. The next use we may make of the drug is its application to the treatment of cantillomata. It is useful in broad flat cantillomata of the anus, of course of cicotic origin. Usually there is some oozing of moisture about them. Thanks for watching this video. If you want more videos like this, please subscribe to this channel and press the bell icon. Comment us your feedback. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.